Hey, hello everyone. This week we had been discussing about the different testings that are done for studying the heart condition, so the cardiovascular testing. And I'm going to talk about 14 tests that are done to study the heart's physiological functioning, and it's just a very broad overview of them. So let's get started. And first of all, the EKG, that's the most common one, as you know, to study the electrical activity of the heart. And it would detect any abnormal rhythm, any sinus tachycardia or bradycardia. Those would be detected, and it's a non-invasive procedure. And people who are complaining about shortness of breath or any chest pain, they are typically advised to check with an EKG. Then the stress test, this is known as the exercise stress test. It's basically a tolerance test to physical activity, and people are asked to walk or run on the treadmill, and the speed is increased, the incline is increased, and while they are hooked up to the monitor to study their blood pressure. And if their heart rate reaches a peak percentage of, let's say, 85%, then 85% or above, if they're good. And during this time, their blood pressure, their heart rate, and whether they're having any angina, those parameters are, studied. Then the next one is echocardiogram, and this one is like the ultrasound of the heart, and sound waves are used to create images of the heart structure and function. So it would give complete information about the functioning of the heart, whether the heart is able to pump the blood by means like the ventricular ejection fraction would be, the left ejection fraction would be detected around, say, 55 to 70 is the normal one, and anything below this range would indicate that there is some kind of potential problem inside. And it can provide information about tumors, if there is any regurgitation of the valves, then if it's a valve issue, if there are any murmurs that are detected as well, then it can provide information about the diameter of the wall, cardiomyopathy, pericarditis, endocarditis, and it can provide information about the general functioning of the condition of the atria and the ventricle. So this echocardiogram would provide a lot of information, and it's quite a very extensive, detailed study. Now, for the stress test, sometimes the stress test and the echocardiogram are coupled together. And the stress test, if it is not an exercise stress test, it could also be a chemical stress test, where dobutamine or adenosine typically are, used to stimulate the heart at par with an exercise, and that would provide information about the activity of the heart or how well it reacts to stress. The next one is coronary angiography, and this is considered as the gold standard for diagnosing coronary artery disease or atherosclerosis. So contrast, this is very invasive, and a contrast dye would be injected into the coronary arteries and to study the blockages or stenosis. And this requires hospitalization. Either they insert it through the groin region or through the arm region, and it often leads to either angioplasty or bypass surgery. So if the blockage is like typically at the junction point or a narrow location or difficult to put the ballooning, then they would prefer a bypass surgery. Does the coronary angiography detect all the blockages? Well, it's very accurate, but it might miss some minor blockages also. The next one is transesophageal echocardiogram, and this is like where a probe is inserted into the esophagus to get clearer images of the heart structure. And it's a good one to study for any blood clots and any infections within the heart. Ankle brachial index, ABI. So this is done to study, to compare the pressure difference of the arteries in the ankle versus the arteries in the arm. And people usually complain about some soreness or cramps while walking. So if there is any reduced blood flow because of any deposition in the arteries, then this peripheral artery disease would be diagnosed by means of this ankle brachial index. And nowadays this test is typically used in screening test as well. The next is electrophysiology study, or the EPS, and this is an invasive procedure and is used to diagnose and treat any abnormal heart rates or arrhythmias. And it involves threading catheters into the heart to map any electrical signals and then use arrhythmias for evaluation. Holter monitor, well, this is a portable device that is worn for a period of time. Like EKG can give you information, but it has limitations because it's on that specific date or that specific time when the EKG was done, and there's always a chance or likelihood that it could miss symptoms. So a Holter monitor is for an extended period of time where this device is worn by the person, and even the person can record it, like any abnormalities the person experiences, they can even record it themselves. And sometimes for an extensive period of time, like for 7 days or for a month, the person can wear the Holter monitor, and it would provide the electrical activity, any arrhythmias, any atrial fibrillation, all of those could be detected. Now, in case of atrial fibrillation, which is very common these days, the atria, they miss out on the depolarization phase. So if there is no depolarization, 30% of the blood that is actually contributed by the atrial contraction is lost. So it's kind of a zigzag kind of waves. Sometimes the heart rate increases, drastically it falls, then it's like very irregular arrhythmia. And that is all detected by Holter monitor. Now, even PVCs like premature ventricular contractions, that would also be detected by Holter. If the person has ventricular fibrillation, that means it leads to heart failure because the 70% blood is not getting pumped completely. The next test is cardiac MRI. This is cardiac magnetic resonance imaging, and it would provide images of the heart structure and function using magnetic fields and radio waves. Any scar tissue, any damage to the heart muscle, myocardium, or any issues with the pericardium, epicardium, that would be detected by the MRI. Then cardiac CT scan. This one uses X-rays from multiple, cross-sectional images of the heart from various angles are obtained. And if there is any CAD or any atherosclerosis, this would be any stenosis, sclerotic plaque, that would be detected by this computed tomography. And they provide a calcium score, and if the calcium score is 0, it's good, and that would indicate that there are no blockages inside. Nuclear stress test, and this is with the injection of a radioactive dye that shows the blood flow to the heart muscle. It's very highly sensitive for detecting areas of reduced blood flow, and it would indicate coronary artery disease or any previous heart attacks. Cardiac catheterization, that's when a thin tube or a catheter is inserted into the blood vessel and threaded up to the heart, and it measures the pressures within the heart chambers. So the next one is carotid ultrasound. Typically it's done in the neck region over here because our external and internal carotid arteries provide blood to the brain, and it's a good indicator of if there's any blockage. It would indicate that there could be a potential brain stroke or hemorrhage related issue. So if there is any stenosis or plaque buildup, that is diagnosed, detected by the carotid ultrasound. Lastly, the biomarker testing. So in case of biomarker testing like troponin protein or beta-type natriuretic peptide, BNP, those are detected in the blood. So typically these are present in the heart, and natriuretic peptide helps in vasodilation. So in case if there is any stress or heart damage or any kind of heart failure, then you would find troponin or BNP likely present in the blood, where they should not be present in a very high level. So these are biomarker tests, and so these are some of the tests that are available for detecting any kind of cardiac anomaly, any heart attack, heart failure, or potential blockages that could be related to sometimes even worse, the LAD is blocked, like the major one, the left anterior descending artery, or which we call as the widowmaker. And if that is like 90% blocked, then it would call for immediate action. So that finishes off the overview of all the tests that are available for testing the cardiac condition, and we'll go over it in more detail. Thank you so much.